Tracheostomy versus BCV ventilator in ICU. What doctors in ICU won't tell you. My name is Patrik Hutzel from intensivcarehotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, control, power, and influence, even if you're not a doctor or a nurse in intensive care, so that your loved one always gets best care and treatment. So one of our members, Anne-Marie, sent us a question. And by the way, we have a membership for families of critically ill patients in intensive care at intensivcarehotline.com. And you can become a member if you go to intensivcarehotline.com and you click on the membership link. So I have this question from Anne-Marie today, who says, "Hi, Patrik. My husband is on tobramycin for Pseudomonas. The doctor says he will be on it for 28 days on and 28 days off. It makes him very tired and sleepy, so they are monitoring him for 7 days. He has mittens on his hands, so why do they put a fall wristband on his arm? I'm still being pressured to do a tracheostomy. I am exploring the BCV ventilator as an option and alternative to the tracheostomy. I had mentioned this ventilator to the first doctor and he told me this was not part of their standard of care. This new doctor is willing to take a look at it. The first doctor was trying to bully me to allow my husband to get the tracheostomy. He came over my husband and was deliberately trying to get his consent and kept saying if I didn't stop intervening, he would have the guards put me out. My husband said no. They gave him no physical therapy or occupational therapy before they tried to extubate him the first or second time. He was always sedated. The first time they tried to extubate him, they didn't hold the feeding tube. He had on the CPAP mask. He aspirated and he had to be re-intubated and his lungs collapsed. I know this is medical negligence. I asked about a tilt board to help with mobilizing. The physiotherapist states they don't use this at this hospital. And mobility is not a priority here, she said. I will email you the medical records shortly. Thank you, from Anne-Marie. Now, Anne-Marie, thank you for your question. Your and your husband's situation is unfortunately very common in intensive care. Families are often pressured into consenting to a tracheostomy without being given all the options or without doctors, nurses, or physios following best practice. Let's break this down. Number one, tobramycin for Pseudomonas. Tobramycin is a strong antibiotic often being used for resistant bugs like Pseudomonas. Fatigue and sleepiness are known side effects. Monitoring is important, especially for kidneys and hearing. Number two, false wristband and mittens. Hospitals put a false wristband on patients as part of blanket protocols. Even if your husband has mittens, it's a liability measure for them, not a personalized care approach. You know, maybe if they took off the mittens and they were actually talking to him to, you know, be calm, and, you know, someone was actually probably looking after him, maybe he wouldn't need the mittens. There's a high chance that he wouldn't need them. Let's look at number three, tracheostomy pressure versus BCV ventilator, which stands for Biphasic Cuirass Ventilation. Anne-Marie, you are absolutely right to explore alternatives like the BCV ventilator. Just because it's quote unquote not their standard of care doesn't mean it's not an option. Many hospitals and ICUs only push tracheostomies because it fits their systems, protocols, and narratives, not because it's always in the best interest of the patient. If your husband said no to a tracheostomy, his wishes should be respected. Forcing consent or threatening to remove you from the ICU is bullying and medical negligence. Now, as you've heard me say here before on this blog, you know, a tracheostomy has its time and its place. And whilst I personally don't have a lot of experience with the biphasic cuirass ventilation, which is, by the way, a non-invasive ventilation technique that uses a portable shell-like device placed on the chest to create alternating positive and negative pressure, thereby assisting the patient's breathing by mimicking natural diaphragm movement, doesn't mean it's not going to work for your husband. It doesn't mean that at all. They need to try and see what happens. And like I said, that's not trying, is bullying and medical negligence. And you should escalate this. Next, let's look at failed extubations and aspiration. Extubation without proper preparation, without physiotherapy or occupational therapy, without holding the feeding tube, and then causing aspiration and collapsed lungs is absolutely poor ICU practice, and it is absolute negligence. Extubation should be planned carefully with physiotherapy, chest clearance, and swallowing assessment. And by them extubating him without holding the feeds for at least 4 to 6 hours, without taking proper preparation and precautions, is medical negligence, full stop. Number 5, mobility in ICU. Mobility is critical in weaning patients off ventilation. The fact that physical therapy and OT wasn't prioritized, and that they dismissed tilt boards, and that they said that mobilization is not a priority, shows you're in an ICU that's not following best evidence, and that's not interested in doing what's in the best interest of a patient, i.e. your husband. So here's what you can and what you need to do. Number 1, get access to all medical records. Number 2, keep advocating for your husband. You are 100% correct in questioning every step. Push for mobility, physiotherapy, and alternatives like BCV ventilation. Demand transparency in medical records, and we'll review them once you send them, of course. Don't let ICU bully you. Their threats show the way they want you to be silent and not partner with you. I am very happy to have a chat with hospital executives, with ICU doctors, ICU nurses. We can also help you to write powerful emails to hospital executive to make appropriate complaints and help your husband to get best care and treatment. Now, once sedation is off, by the way, sedatives and opiates need to be switched off. It sounds like he was extubated on sedation, which is, again, medical negligence, right? Then he might actually succeed in extubation. Also, if he's still too sedated, he's at high risk of aspiration. If he's too sedated, the BVC ventilation won't work, so he needs to be more awake. And once he's more awake, you can map out the next steps, whether that might be a tracheostomy or that might be BVC. First off, he needs to be free of sedation and free of opiates, right? And just for the records here, sedation is often in ICU propofol, midazolam/Versed, and or Precedex, dexmedetomidine. Opiates often and commonly used in ICU are morphine, fentanyl, sometimes oxycodone, OxyContin. So here at intensivecarehotline.com, we help families like yours to have power, control, and influence, making sure your loved one gets best care and treatment always, so that you can make informed decisions. And the fact that the free advice here is already helping you should show you how powerful my advice would be if you get on a one-on-one consulting and advocacy call with me, because I can cut the time to life-saving results down to hours, sometimes even minutes. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And I can very, very, very confidently say that we have saved many lives with our consulting and advocacy because of our insights, and you can verify that on our testimonial section at intensivecarehotline.com, and you can verify it on our intensivecarehotline.com podcast section, where we have done client interviews. And because our advice is absolutely life-changing, right? The biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And that's why we help you to improve your life instantly, making sure you make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And that's why you can join a growing number of members and clients that we have helped over the years, saving their loved ones' lives. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And when I talk to families directly. I also talk to doctors and nurses directly, asking all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care. So if in case you have unanswered questions, if you need closure or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care. And you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded. And all of that will help you to improve your life instantly, make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification from the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrik Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.